morning, everybody. Nice to see a 12,000 registration today. We are overwhelmed of yesterday's response. That's why we could scale up from 100 to 10,000 today. I think we can have 10,000 viewers today. Apart from it, we are going to place it on our website. Yesterday video we could not upload because some technical hitch. I think by today afternoon we'll be able to do that. It will be available on our website. So I request everybody be watching our website. Now today, from yesterday's, I think it was very informative for you, and it was a pre-clinical, whatever it was. Today, from today on, we are coming with infection prevention and control. So the sessions will be taken by our panelists, Dr. Punita Izilarazu and Lieutenant Colonel Dr. Sarvajit Kaur. So now over to Dr. Punita for today's session.
A very good morning and a warm welcome to all of you who are listening from various parts of our country. And I'm extremely delighted to have so many of you who are interested to listen to this particular topic. I know as you again the COVID-19 outbreak, which has become a pandemic. And today we are starting a new series, Prevention and Control. This has and transmission-based precautions. And the second one is hand hygiene. And the third one is PPE. We have today 2 of our sessions today. The other one, PPE, will be carried on to the Monday morning session. So as we begin with this infection prevention and control, I will be dealing particularly on infection prevention control, what it is, and specifically on the aspect of standard precautions and transmission-based precautions. As all of us know, IPC, it is a scientific approach and it is a practical solution that is designed to prevent harm caused by infection to all our patients and also healthcare workers. And I understood that no country or no health facility, whether they are simple or complex or sophisticated, they can claim to be free of healthcare associated infections. Every health facility faces some form of healthcare associated infections. Therefore, I would like to start by saying how significant it is to learn about infection prevention and control, particularly in the context of COVID-19. The infection prevention and control is vital to the efficient functioning of the health system. And what is this statistics that are available? The statistics that are available by WHO, particularly in terms of this infection prevention control, I was just browsing it and I found that 10%, that is 1 in 10 patients get infection while they receive the care, and 50% surgical site infections can be antibiotic resistant, and 30% of healthcare associated infections can be prevented by effective IPC. Therefore, we know how relevant it is to know about infection prevention and control today in this context. We have several guidelines that are being prepared, both from WHO, we have guidelines for CDC, we have national guidelines, and all these are based on the core components of the IPC from the WHO. And WHO has recommended that IPC guidelines be framed at all nations at a national and health facility level. And all these guidelines should be evidence-based, and there must be a component of surveillance, different strategies, monitoring and audit, workload, staffing, bed occupancy, and built environment, materials and equipment. And all guidelines related to these aspects have to be evidence-based, and it has to be at the national level and and the health facility level. And we have a national infection prevention control guidelines, which has been framed very recently, January 2020, that Government of India has. That's the greatest response to all the emerging epidemics, pandemics that are coming in the world as well as in our country. And these guidelines address all sorts of infections, including healthcare associated infections. Now let's move on to the standard precautions. The standard precautions, this is a primary strategy for minimizing the risk of transmission of microorganisms in healthcare facilities. And what are standard precautions? These refer to work practices that apply to all patients receiving care in health facilities, regardless, to minimize the risk of transmission in all situations, whether they are suspects or whether they are confirmed infections. And these are to be used as secretions and excretions. And these practices are designed to protect direct healthcare providers and also prevent them from spreading infection among patients. Now, when the standard precautions alone cannot prevent transmission, they are supplemented with transmission-based precautions. Now, what are transmission-based precautions? Transmission-based precautions are precautions. They are required to be taken based on the route of transmission of organisms, like contact precautions, airborne precautions, etc. There are many components, key components of standard precautions. We move on to standard precautions. Those are in detail. And then we move on to the transmission-based precautions. The key components of standard precautions are hand hygiene, personal protective equipment, respiratory hygiene and cough etiquette, prevention of injuries from shocks, safe handling of patient care equipment, principles of asepsis and environmental infection control, and this also includes the biomedical waste management. Coming to the first component, the hand hygiene. This is the most single important measure for the prevention of infection, and studies have shown that hands are most common vehicle for transmission in the healthcare environment. And what does it include? Hand washing and rubbing, and the details of hand hygiene will be dealt in the next session. Therefore, I will not dwell in this particular topic. I will just mention and move on to the next one, hand hygiene. There are two pictures which are shown here in the next slides. I am not going to discuss it, move on, because it is going to be discussed in detail in the next session. And I will move on to the second part of it, that is the personal protective equipment. Personal protective equipment, they are physical barriers used alone in combination to prevent mucous membranes, airways, skin and clothing from contact with infectious agents. And they should be used by all healthcare workers and support staff who come in contact with blood, body fluids, excretions, and secretions. The personal protective equipment includes gloves, aprons and gowns, facial protection, footwear, hair cover, cap, and mask. This is by the CDC. The next picture, which shows the various steps of donning and doffing, I am not going to deal today. We will be dealing it on Monday on the PPE as a whole, that is very purely on the healthcare facility. All the details of it will be done in the context of COVID-19, that is respiratory hygiene and cough etiquette. Respiratory hygiene and cough etiquette means the measures taken by a person having signs and symptoms of respiratory infection to other persons. Every individual, including the patients, staff, and visitors, should be educated on respiratory hygiene and cough etiquette, and thus limits the transmission of respiratory pathogens which are spread by droplet or airborne routes and are very specifically used when coming in contact with symptomatic persons. There are many measures that have to be taken into consideration, and all of us need to follow them. They are: first, cover mouth and nose with a tissue when coughing and sneezing. All these respiratory hygiene and cough etiquette, various measures we have been seeing in various posters and various media. And if you really ask the public, most of them are quite aware of them. And I could see that there is a lot of growth in different settings and also in the community in terms of adherence to this respiratory hygiene measures, because we know people are very much threatened by the disease. And these are some of the ones which all of us know, even the public knows. And however, I would like to list some of them. Covering the mouth and nose with tissue and coughing. Dispose tissue after use in the nearest and wash hands. Perform hand hygiene after contact with the respiratory secretions and contaminated objects of tissues and foot-operated waste bins. Ensure, if it is not available, cough or sneeze with the nose and mouth covered with the arm and wash hands. And it is also said, if it is not available, even hand washing facilities, you will cough or sneeze on the elbow where the contact is less, the upper arm where it is not very much in contact, and later on you could wash hands. The next slide. The next important aspect is to provide conveniently located dispensers of antibacterial hand rubs. Where sinks are available, ensure that water and soap for hand washing are available at all times. Display posters at areas where people gather to educate them widely on respiratory hygiene. Wherever the posters are there, if it is not in a language that is not known to them, people who are watching that, it doesn't make any sense. Therefore, the posters have have to be placed in local language also. And it has to be across OPD, entrance, emergency department, and various clinics, doctors' clinics, and all the places where the public sees, various media is bringing out various type of posters. So it has to be in across the country, in all places also, apart from the health facility. And these hygienic measures should start from the point of entry into the health facility, and it has to go continuously. It has to go throughout the visit in the OPD or any labs or in the inpatient facilities. The respiratory hygiene, the next important aspect, it is educating people. Because not just say that this is the one, everybody needs to know about these things. So you need to keep on educating people. Education is for patients, staff, visitors, and public. Why are we having so many kinds of education and training sessions across the country by different groups of people in different forms? Now that with the lockdown, nobody is able to move out. So people are trying to educate each other, even sitting at home. And a lot of work is going on online. And because you cannot miss out that, and that is what INC is also trying to do, how we can educate our staff, how we can educate our students, so that we will be prepared to educate patients and also prepared to educate their family members, public, and all other co-workers. What are some of the aspects that need to be kept in mind? Avoiding close contact with people who are sick. Stay at home when you are sick. Cover your mouth and nose with a tissue or handkerchief when you cough or sneeze. Some are repeated, but we know that these are very important. And in the absence of handkerchief tissues, cover your nose and mouth with your arm during coughing and sneezing. Wash your hands often with soap and water. If soap and water are not available, use a hand. We know that in most places, even in the community, that you find that all people are trying to wear either mask or trying to wash hands. So that awareness has permeated, and people are trying to follow some of these things, probably because of the threat that they have. However, a lot of learning has taken place amongst the public. And the other aspects continue, like avoid touching your eyes, nose, or mouth. Practice other good health habits. Clean and disinfect frequently touched surfaces at home, work, school, especially when someone is ill. And get plenty of sleep, physically active, manage your stress, drink plenty of fluids, and eat nutritious food. Many WhatsApp messages, a lot of media talks about being active. You need to be active throughout the day. It's very, very difficult. We know there are a lot of stress going on because we have to be inside the house, and particularly the male population, they are finding it very difficult to be inside. A lot of stress going on. To be active is so difficult. But however, exercises may be static within the home, have to be done, because being active is very, very important. And also how to manage the stress, a lot of fluids, that is very, very important, and nutritious foods. All these are very important, the foods mainly to improve the immunity. Now, prevention of injuries from shocks. This is again the fourth aspect of standard precaution. And this is very, very important, especially in prevention of bloodborne infections. And this talks about how do we handle shocks. I know all of you are aware of all this. Many of us are working at the health facilities, involved day in and out, and we are working in the communities. But these are for reiteration so that we will not miss out any of the things which are very important. Used needles must not be recapped by hand. If necessary, use the single hand scoop method. Used needles should not be bent or broken after use. Used sharps should be disposed of immediately in designated puncture-proof containers and with the biohazard label. And these kind of waste disposal to incinerator or others has to be as per the healthcare facility policy. So the healthcare facility, all of them should have written policy for all this. Now, next slide. Shops, handling shops, there are many other aspects too. It should be used only once. A handful of sharp instrument must not be picked up simultaneously. While handling sharp, positioned away from oneself and others. If injured by sharp, contact the ward, clinic or unit supervisor immediately for further management. And sharps should be disposed of in a puncture-proof container as recommended by biomedical waste management guidelines. We have biomedical waste management guidelines or rules in our country, and which has been revised or amended in 2018, and we have the latest 2019 too. Handling of patient care equipment. So we looked at the shops and the details of it. Much more is national, infection prevention guidelines. It is available in the net, so you can always go through it. All the aspects of it, and also biomedical waste management rules will also tell a lot of points, related points in terms of managing shops. Safe handling of equipment. How do you handle patient care equipment? Equipment that has been in contact with the patient should be disinfected. Say equipment that has been in contact with the patient should be disinfected and sterilized as appropriate before use for another patient. These are all ideal things and which are mandatory. And carefully decontaminate and clean equipment before use for each patient. And personnel should be trained for this. Have a hospital disinfection policy and monitor its implementation. Every hospital is expected to have infection control committees. They have different components of every committee work, and hospital has disinfection policy, particularly for appropriate cleaning, disinfection, sterilization of patient care devices that come in contact with mucous membranes and access sterile tissues. So the hospital infection policy always consult the national infection control, prevention and control guidelines, and they are framed and they are adhered, or they are monitoring, auditing and seeing that they are adhered. A new equipment or a serviced or repaired equipment again should be cleaned, disinfected before patient use. Heavy duty or strong utility gloves must be worn. Soiled patient care equipment should be handled in a manner that prevents exposure of skin and mucous membranes and contamination of clothing and environment. Disposable patient care equipment should not be reused and must be discarded. Patient care supplies like lotion, cream, soaps shall not be shared by patients. The next, just want to stress on two aspects which are also part of standard precautions that are included, like injection safety and safe waste management, disposal and management. These two areas I would like you to look at the national guidelines. It's very clearly said, and it also talks about the various aspects of injection safety practices and the very specific don'ts for injection safety. I would like to list them so that you will be able to recall and refreshed on this particular aspect. Don't allow the needle to touch any contaminated surface. Do not reuse syringes. Do not touch the diaphragm after disinfection with 70% alcohol. Do not use the same needle and syringe for several multi-dose vials. Do not use same mixing syringe and reconstitute several vials. Do not use a single loaded syringe to administer medication to several patients. One needle, one syringe, one patient. Change needle to reuse the syringe. Do not change needle to reuse the syringe, and do not store leftover medication for later use. These are the don'ts for injection safety. The safe waste management, you must remember, 10 to 25% of the hazardous material waste is generated in a healthcare facility. This includes segregation, collection, pre-treatment, packing, storage, and transport. So these are important aspects that has been given in the safe waste management. These are the various components. And the various principles, while we are looking at the standard precaution, keep these principles, a list of it is just given for reiteration. Hand hygiene scrubs, surgical asepsis, cleaning, disinfection of surface, maintenance of sterile field, and PPE. These are main components and principles. Now, the next seventh important act is environmental in difficult period of tackling the COVID-19 infections, which is also spread by contact. We need to remember there are quite a number of measures that we need to take in terms of environmental infection control. The number one important aspect, it is patient placement. The space between the beds should be at least 1 to 2 meters. The single room with hand washing and bathroom facilities are preferred. I know this is ideal situation where you need to have a single room, where you need to have only one patient with all the facilities within this, contained within the area. But I know that nowadays when a lot of patients, a lot of people who are suspect, who are having symptoms are placed, put them in places where you don't have single room. Isolation rooms should have changing room to support the use of PPE. This is when you say isolation room or a separate room, even the changing room, everything should be contained within the room, the separate room. Now, what about the cleaning? How do you keep the room clean? The room cleaning has to be done before admitting the patient, after admitting the patient, the regular cleaning, and once the patient is discharged, that is after discharge, terminal cleaning. And all patient care equipment should be replaced, disinfected as per the hospital policies. The National Guidelines on Infection and Prevention Control talks about how you can prepare the disinfectants and also what are the different types of disinfectants. The important one for environmental cleaning that is suggested, recommended for surface cleaning it is the sodium hypochlorite 1%, and the tabletops 70% alcohol isopropyl, and instruments cleaning and disinfectant, and use of detergent with enzyme. These are the different recommendations. I've just picked up a couple of them. You can read through and how different concentrations of disinfectants are prepared, and what are the different types or recommendations for what type of cleaning is being spelled out very much in detail in this infection control national guidelines. The next part of infection control aspect is transportation of patients. When you say transportation of patients, the movement should be restricted and isolated. First of all, as far as possible, we should eliminate, or we should restrict the movement. There should be restricted movement or no movement. If necessary, transport the patient with a surgical mask on the face and take care of all the tubing and equipment. Change the trolley cover between patients and clean trolleys and wheelchairs immediately after transporting the patient. And if the patient has a lot of lines, IV lines and shunts, it has to be covered with sterile dressing during transportation. Now in the facility, we need to have a policy for visitors. Visitors should not be allowed for patients with COVID-19. If necessary, one person wearing the PPE can be present. Now we know that visitors are not allowed at all when they are admitted in the COVID units. That's a policy for visitors, and government has, different state governments have different strict policies that has been informed to the various hospitals, and they are following. A lot of discipline is going on both in healthcare facilities and also in the community. And in order to have these different measures, we all said about the various standard precautions, and to have these measures to be improved or to have the adherence improved, what are some of the important components? If we have to adhere to all this, and if all these measures are taken by the patients, families, visitors, healthcare workers, what are some of the important aspects? Education is one of the important aspects. And staff education, particularly for hand hygiene, other standard precautions about that. Education is very, very vital. And ready access to PPE, visual reminders and verbal reminders, posters, both in health facilities centers, because the staff had to be continuously educated, trained, and reminded, because we know that even though we have learned in student period, we have learned in the staff period, again that we have been working in all these areas. Sometimes maybe we were not working in isolation areas. A lot of reinforcement, refreshing knowledge needs to be given and taken. So reminders are important, visual reminders, verbal reminders, a lot of posters in and around, and also to see everything is pre-packed, pre-organized packs. Not in the last moment to get ready for various procedures, it has to be pre-organized packs. And monitoring is very important, safety rounds, monitoring of adherence, and if there are relapses, we may have to really take disciplinary action. So if all these elements are taken into consideration, all the improvement in the adherence will take place. So these are some of the things in the healthcare facility where the nurse managers, when you're planning and organizing, planning for COVID wards, and also ICU facilities, organizing the staffing, the staff workload, and leave and staff welfare, PPE, provision of all the PPE standard precautions available. All that when you're doing it, you should also simultaneously look at it. How do I improve the adherence, to standard precautions by our staff. These are some of the very important. Once we have looked at all the standard precautions, the two important aspects of standard precautions, we have not looked at it, that's hand hygiene and PPE in details. It is coming in. It is the next and the following sessions. And I move on to transmission-based precaution, which is also very important. Some of them are repetitions, but they are reiterating important aspects. Transmission-based precautions. These precautions are for aseptic techniques and device management for clinical procedures applied in addition to standard precautions, depending upon the epidemiology and route of transmission of the agent or disease. So this is particularly in relation to the transmission method. The droplet precautions are very, very important here. Here again, there are two different things. One is airborne precautions and droplet precautions. Here, in the context of the COVID infection, it is more relevant of droplet precautions. It is not, the virus is not existing in the air, and even if it comes to the air, it stays for a very short period and it cannot travel a long period, over a long distance. So the airborne, precautions will come, airborne precautions will come exactly when there are lots of procedures that involve aerosol infection, generating procedures, aerosol generating procedures, intubation, while intubation, coughing, and also endotracheal suctioning, and so on. So many of the procedures, when it is done, the airborne precautions have to come in. Here, the droplet nuclei may be just 1 to 5 micron. But when it comes to droplet precautions, it is more than 5 micron. And this occurs through large respiratory droplets. And they occur when droplets are expelled by coughing, sneezing, talking, and come into contact with another person's mucosa, eyes, nose, or mouth. These microorganisms do not travel over long distances. And the important other precautions keep a minimum of 1 to 2 meter distance and explain the importance of respiratory hygiene and cough etiquette to patients, and also wear a triple layered surgical mask within 1 to 2 meters of the patient. It is advisable to use the mask when entering the patient's room. But for aerosol generating procedures, N95 mask should be used. And patients should wear a triple layered surgical mask while transportation. And the patients are to be placed in isolation, particularly this is as a droplet precaution, and decrease the OPD waiting time and facilitate early departure from clinics. Admit patients only if necessary and symptoms are severe. Home care should be advised for mild symptoms, and all healthcare workers coming into contact with the patient should wear PPE. So these are very, very important droplet precautions, and we know a lot of these things are happening. The OPD, many of the OPDs, we don't see too many patients, and the time are very, very limited in terms of seeing, and the distance, social distance that is maintained between the doctor and the patient. There are a lot of changes which is happening in different health facilities as a part of the guidelines that has been given in terms of taking precautions or infection prevention and control. And contact precaution is very important, because any droplet which falls on any surface, from that again it can be transmitted. This again, it could be a direct or it could be indirect transmission, and this is transmitted, and when it is contaminated, hospitals in detail will be taken care of in separate session. Therefore, would like to conclude that for prevention of transmission, hand hygiene, respiratory hygiene, cough etiquette, and use of PPE and environmental hygiene are very, very important standard precautions. And precautions for droplet infection should be taken to break the chain of transmission. I conclude with this, and we will move on to the next.
And now I request Dr. Savajit Kaur to take on the hand hygiene.
Thank you, Bharti. I extend a very warm welcome to all dear friends. We have a very large number and we're very glad to be sharing this platform with all of you. Today's session is going to take us back to when we first stepped into nursing. This is a class, this is a reminder of what is safe care, and hand hygiene is the central part of this clean and safe care to be given by nurses. Next slide, please. In today's session, we are going to describe the use of hand washing and of hand rub and the ways of using them for infection prevention, and especially keeping COVID-19 scenario in mind. Next slide, please. WHO has defined hand hygiene to be the single most important measure for prevention of infection. The handle for transmission of healthcare associated pathogens. The hands of the health, when they come in contact with the patient or with the patient surrounding or the environment of the healthcare facility where they are working, or when they are interacting with other healthcare workers of the health team. Health hygiene, it helps to remove the visible dust, soil, organic material, transient micro cross-contamination within the healthcare team. There is no evidence that the health hygiene is directly related with reduction of hospital-acquired infections. There are various randomized controlled trials which have been done on this. Next slide, please. So let's learn how do you do hand decontamination. So we have for this the routine hand hygiene. There is hand washing with soap and water whenever you can see that your hands are visibly dirty or they are soiled. Second is hand rubbing with an alcohol-based preparation. This again has now become a routine in most of the healthcare settings where hygienic antisepsis is being done. And of course, before any surgical procedures, we have the surgical hand rub. Next slide, please. So when do we do hand washing? The indication is whenever there is a visibly heavy contamination, like when you are handling, say, dirt, soil, proteinous material, especially at the time of, say, reception of a patient into a new unit, when the patient has just walked down, or when there are blood or body fluids while doing any procedure. So hand washing before and after is indicated. The total duration of entire hand washing procedure should be around 40 to 60 seconds. Next slide, please. The routine hand washing, as we have been told, has to be done on a normal social handling before and after having our food. All these components are well engraved into our mythology also, which tells us about good hygienic practices. When the hands are visibly dirty, we have to perform a routine hand wash using soap and water. In the clinical setting as healthcare professionals, there are different scenarios in which the hand washing is indicated. It will be seen in the subsequent slide also. So before touching a patient or before any clean aseptic procedure or after a body fluid exposure risk, after touching a patient, when we are moving to another patient, also we are supposed to clean our hands, and after touching the patient's surrounding. The same, these 5 very important movements in a clinical scenario are shown through this diagrammatic form also. The number 1, like I said, before touching a patient means at the time of entry into a patient's unit. Say you're entering, we are talking of COVID patients, so before that, you have to have a hand washing. Before doing any kind of clean or aseptic procedure, it could be as simple as a bed making for a patient, or it could be doing any, say, intracat insertion or catheter insertion, cleaning of the patient's body, you have to have hand washing. After body fluid exposure risk, suppose it is there, then after you have touched this patient also, when you're moving out of the patient's unit, hand wash is very important. And even if you have touched the patient, some adjustment, touched something, you have to do a hand washing. Next slide, please. We all know about steps of hand washing. We are going to discuss the hand washing steps as given by the WHO. So the first step is to wet hands with water. So the tap has to be properly placed. We have all worked in different scenarios and seen the position of the normal sink and tap in the patient care scenario, as well as in surgical scrub areas like the operation theatre, the burns unit and all, where surgical hand washing is to be done. So that's the first step. Wet hands with water, both the hands. Next, apply enough soap to cover all hand surfaces. There are normally soap dispensers placed. If there are no soap dispensers, then the soap has to be taken in the palm of the hand, and using the water that already has been taken, enough lather has to be created so that it can cover all the hand surfaces. Then rub hand palm to palm. We all know this. So once we have taken, we have to rub palm to palm the soap which is there to create enough lather. Next. Then right palm over the left dorsum. By interlacing of the fingers, we have to rub the palm. The fingers have to be interlaced. Next step, please. Again the same, the fingers have to be interlaced properly when this rubbing of the back of the palm is taking place. Next, please. Then there is finger interlocking and rubbing the back of the fingers through these movements. Next comes the thumb. So there is rotational rubbing of the left clasped in the right palm and the right clasped in the left palm. Next, please. Then we have the cleaning of the fingertips. This again, by approximating the fingertips into the palm, this is the step. Next, please. This is followed by washing, cupping of the hands and washing it very cleanly, rinsing the hands with water to remove the entire soap that is there. Next, please. Dry the hands thoroughly using a single-use towel. In our clinical scenarios, we have different methods of drying hands. So we may have disposable paper towels, we may have single-use cloth towels, or we may even have hand dryers. Various studies have been conducted to see the efficacy of these different methods. If properly followed, all the methods are efficient. The last is to turn off the water tap. So you use the towel to turn off the faucet. Next, please. And the towel needs to be disposed of. It is found that the reusing of towels leads to various incidences of there being more contact and more contamination. So single-use towels is the best. After you have followed all these steps of hand washing, your hands are now safe to give care. Next, please. It is important to remember that these steps that we have learned with soap and water, these different steps which cover all the parts of the hands, are also important to be remembered when a hand rub is being used. The hand rub is ineffective if it is not covering all these steps of hand washing that we do with soap and water. Hand rub is used when the hands are not visibly soiled. We have to remember that these alcohol-based hand rubs, they may reduce the bacterial counts which are there on the hands, but they do not obviate the need for hand washing with soap and water whenever there is a visible contamination, because these alcohol hand rubs, they're not very good cleaning agents when the hands are visibly dirty. Visibly dirty hands should be washed with soap and water. An alcohol-based, previous slide please. An alcohol-based hand rub solution can be used. It should contain at least 70% alcohol to be effective. The WHO statistics suggests that between 60 to 80% alcohol hand rub is very effective. So then why don't we use 100% alcohol rubs? The reason simple for this is that for the ethanol to act, it acts by breaking down the protein bonds, that is by denaturing the proteins, and this can take place only in the presence of water. So when the content of alcohol increases beyond 70%, that is the water content goes down, it actually acts as a paradox and it doesn't make an effective hand wash. It has to have that much content of water also. So the entire duration of this procedure again is 20 to 30 seconds, remembering all the steps that we have discussed before. Next slide, please. So let's see, how do you again use a hand rub? Apply a palmful of the product in the cupped hand, covering all these surfaces. Now, with this hand rub also being used as hand sanitizers in all our home settings also, we should remember that we should press it either using the tip of the elbow if we are coming up from outside, or we should take special care to disinfect the plunger that we are plunging for the hand rub also. Next slide, please. Again, the steps are the same. Rub hand palm to palm in the same fashion as we had seen. Next, please. Right palm over the left dorsum with finger interlacing and vice versa. Next, please. Palm to palm with fingers interlaced. Next, please. Again, back of the fingers with back of the fingers to be cleaned of the opposing hands. Next, please. The rotational rubbing of the thumb of both the hands. Next, please. And rubbing backward and forward for the tips of the nails. Next, please. And because it's an alcohol hand rub, we have to allow it to dry. Once dry, your hands are safe. Here with hand rubs, we're not using any kind of towels or paper wraps. The advantages of alcohol-based hand rubs are first and foremost of them being easily accessible at the point of care. Because it is not always possible to have hand washing facilities in the form of a sink, a tap, a water supply, water connection, right up till the patient's bedside. So the alcohol-based hand rubs come in very handy over there. They have excellent antimicrobial activities against gram-positive and gram-negative bacteria and also a wide range of fungi. They are generally good antimicrobial activities against enveloped viruses. The disadvantages are they are lesser or sometimes variable antimicrobial activities against non-enveloped viruses. So there is some group of bacteria and viruses on which the hand rub may not be classically effective, but they are very, very limited. On a wide range of disease-causing organisms, the hand rubs are effective. There is no activity against protozoan oocytes, bacterial spores. Next slide, please. So what is surgical hand rubbing? Surgical hand rubbing, we know that before doing any kind of invasive procedure or any surgical intervention, proper hand washing from at the elbows, from above the elbows till the hands is mandatory. Hand scrubbing with an antiseptic agent before beginning a surgical procedure reduces the number of microorganisms and inhibits the growth of microorganisms on hands under the gloves. Chlorhexidine, povidone iodine containing soaps, and there are various other materials that can be commonly used for surgical hand scrubbing. So in the end, I would like to conclude by saying that during this crucial time of this epidemic, hand hygiene is crucial to break this chain of transmission. It is a very simple yet a very effective solution to reduce the spread of infection and also protect our patients from hospital-acquired infections. It is important that all the nursing personnel, in whichever capacity they are working, they ensure that the health system has the right kind of intent for proper hand hygiene facilities in the form of safe and continuous water supply, having provisions of soap, towels or sanitizers. Reminders for hand washing should be well placed, not only for the healthcare team, but also for all patients and their relatives. We wish a very happy and pleasant hand washing experiences for all the nursing faculty, and let's ensure that we become very important members in breaking this chain of transmission. Thank you so much.
Thank you very much, ma'am. There's, I do not know where is Dr. Punita over here. I'm not able to see her. We do have some questions, but I don't think we have much time today to answer. It's already 12:05. We have one same what yesterday, but because today the number of participants are more, I think we may have to answer this. Is BCG vaccination can decrease epidemiology of COVID-19? Can Dr. Punita take this question? Dr. Punita?
There is no evidence, there is no vaccination that is identified for COVID-19. That's one thing. There is no more vaccination available, and a lot of research is going on, and it is said hopefully within the next 6 months we should be able to get a vaccine. BCG vaccination is not for this particular virus. So you cannot use this to vaccinate for COVID-19. How is that possible? You have to wait and see when the vaccination for COVID-19 will be available.
Second question, I think I can answer this. Can we get this content so that we can communicate to maximum number in reference to INC? Yes, It will be available on the website. As I said, there's a technical hitch of yesterday's video. Once we get through that, second video will be also today will be placed on the website only after placing the first video. Again, there is one question that today's weather is too low, which we want to got it for a prevention from COVID-19. Maybe they are talking about the climate change, ma'am. Whether if it is become hotter, whether the COVID-19 will come down.
Yesterday, I did mention that we have several myth busters, and one of it is in relation to temperature. Temperature does not have anything to do with prevention of infection, and whether even the body temperature is about 36 and 36.5, so that it survives. Therefore, the temperature is not going to be any myth buster, not a truth.
Whether coronavirus is airborne, yes or no?
Okay. I think the question came up because I mentioned about airborne. I should not have mentioned about airborne. I mentioned it because of the aerosol precautions, because of the aerosol precaution that we need to take it for us. While doing procedures, I did mention, otherwise this is not an airborne disease, and this is a droplet infection. And you must remember what is airborne and what is droplet. Airborne, the virus, whatever is less than 5 micrometer and which can be found more than 1 meter distance. And a droplet has to be, thick, or is more number of particles, which is more than 5 to 10 micrometer, but it is not available across. That means not beyond 1 meter, less than 1 meter. Therefore, the COVID virus cannot stay beyond 1 meter, so it is only a droplet transmission, not an airborne disease.
Ma'am, there is a question, if we do not have a stock, the PPE stock, what is the alternative on the basis of standard precaution? Shall I repeat the question?
Dr. Savajit would like to answer.
We had spoken yesterday regarding being prepared, to be prepared and to be ready. So the hospitals, whenever such a pandemic situation is being raised, like before coming to our country, this has also gone to other countries, and from there we had an indication that yes, this is the course of disease and this is the kind of PPE that is going to be required. So the government takes necessary steps towards that, and the hospitals equip themselves. So now also we are hearing and seeing also various guidelines which have come up for various PPE, and how we are seeing in different case scenarios how the different healthcare professionals are stepping in to have their own contributions to improve this. However, this is a concern and it needs to be, put up to the appropriate authorities.
There's a question, ma'am. Is there any special instructions related to collection of waste from a COVID diagnosed patient or articles used for same by healthcare worker?
Guidelines are same for any infectious waste. We have the biomedical waste disposal guidelines where you have different colors where the infectious waste, how it is segregated and all that. So COVID doesn't have a separate one. The same guidelines will be applicable to COVID also.
Dr. Savajit Kaur, there's one question on if there is non-availability of tissues for low economic status, then they're using any cotton clothes. What should they do for cleaning these things?
Cotton clothes to be used, okay, in the form of hand rub, I mean for hand hygiene.
No, ma'am.
Question is from,
What should they do for cleaning these things? How do whether it is a washing the cotton clothes with the warm water? How do they're asking how to keep this clean? For
the standard, yes,
cotton
I've
clothes.
understood. The standard disinfection policies have to be kept in mind. And the cotton cloths, if you're wanting to reuse, like you're telling that there is some kind of paucity and you want to recycle or reuse it, then proper disinfection by soaking it in the right disinfectant, then washing it up with soap or any detergent, any disinfectant, and then only you have to dry it, and then only it can be reused. In most of the scenarios, we also send for autoclaving before reusing, if you want to reuse any cotton-based items.
How lockdown can play a big role in stop COVID-19?
What's it?
How has the lockdown helped?
Lockdown.
Yeah, lockdown.
This again, I feel we have discussed yesterday when we have discussed the concept of social distancing. I request the attendee to go through the webinar that is placed on the INC website, and the question can be answered very clearly from there.
If a person have only mild to moderate cough more than 10 days, what advice we should give him? Yes, Dr. Punita, if a person have only mild to moderate cough more than 10 days, what advice we should give him?
For screening, yesterday we had for this preparedness, readiness and all that, symptoms for the screening guidelines have been given. Naturally, the screening has to be done and also testing has to be done.
There's a question, in spite of using all safety equipments, can healthcare providers get infected? As many are getting, doctors and nurses are getting infected. What can be done for them?
See, we cannot, yes.
Ma'am, I feel if the proper personal protective equipments are being used in the right way, then the healthcare professionals have nothing to worry about. We have had incidences from other countries where the disease has finished its epidemiological cycle, and we can find that the number of healthcare workers affected in proportion to the practices they followed, there is a direct link. So we have to follow the infection control guidelines very strictly and protect ourselves.
I think Singapore had an example. Singapore is an example for that.
Can we use sodium hypochlorite or for disinfect the articles? I think you have answered that in the session, I mean. You would like to answer it again, ma'am?
No, I said about the preparation and for the surface disinfectants, hypochlorite 1% I said. I think probably they didn't get it.
My question is how the prevention of blood-borne infection is helpful in COVID-19.
COVID-19 is not a blood-borne disease, but we know that seriously critically ill patients, and many of them have they have comorbid conditions. So it is always good to know about the bloodborne precautions, and that is why it is, I mean, as a part of standard precaution, it has been said, and we should be knowledgeable to take all bloodborne precautions also as a standard precaution.
If I touch phone of coronavirus patient, can I get infected? Anybody? And Dr. Savijit, can you take that question?
There is a high chance, because if the person is a confirmed case, confirmed through laboratory diagnosis, and we know that when we are using our phones, we are producing some kind of aerosols and droplets. So yes, the telephone or the mobile is one thing which requires proper disinfection. If we are handling, if as healthcare providers we are handling any equipments of the patient, then we have to follow hand washing very strictly after that.
There's a question one. I think Dr. Punita can answer that. As it is said, single isolation room is required, but as we see now, patients are kept together, which is a cohort isolation. My question is the staff taking care of the patient in cohort isolation are more at risk, or else patients in single isolation room are more at risk? Is the same safety measure are applicable for both cohort and single isolation?
What is ideal is single isolation, but where single isolation is not possible, the cohort patients diagnosed, those are diagnosed to have COVID, they are kept together, and all of them have got the infection and they have the positive. So the precautions that need to be taken are the same for taking care of COVID-19 patients, because there is no question of COVID transferring from one to another. So all the standard precautions with the transmission-based precautions have to be taken by the healthcare workers in taking care of patients. But only thing is, you won't have too many people. Maybe the cohorts will be smaller so that one nurse will be able to manage.
There's one more question, ma'am. What percentage of sodium hypochlorite need to be used as best effective for patient room cleaning and for both?
Surface disinfectant, it is 1%. See, 1% is effective. There's always we use the 1% hypochlorite.
There's one question on the mask. I think Dr. Savijit Kaur, if you can answer that. Which type of mask general population can use, which can prevent themselves from COVID-19?
For the healthcare professionals, as per the guidelines, it is the N95, and for the common public, any triple layered mask should be sufficient. We are having different kind of masks being sold in the market areas. I think the one that is at least got 3 layers, triple mask, they are the ones that prevent that size of the droplet from, being inhaled. So they are the ones, and the common public should remember to cover their noses. It is very amusing to see people crossing you or walking by, or you see on the televisions also with their noses being exposed. So the mask has to be tied properly, and it should not be hung loose so that there can be some kind of air entry from the sides. So it should be a snugly fitting, properly tied, triple layered mask which should be used. However, in the absence of any kind of mask, if we do not have, then even a double layered cotton cloth can be tied in the form of a handkerchief. But that, of course, is not the ideal setup. Triple layered mask is the ideal.
Duration of virus in air and the distance it can travel, can you please specify?
Um,
1 to 2.
no, ma'am, please.
Yeah. In the in the surface area, it can stay longer, maybe 6 hours or even to several days. They say it can stay on in the surface area, but in the air, it cannot stay longer. Probably within 3 hours, and it cannot go beyond 1 meter. It is within 1 meter, 1 to 2 meter maximum. So that is what the virus can stay in the air. The knowledge goes on like that, but in the surface it can stay longer. So that is why the surface contamination is the contact transmission is very high.
President sir, would you like to answer this question? It's a question from the student. As a student, can we cover village people about the COVID-19 because they don't know about the sign and symptoms and about this COVID-19?
I think the students should take the help of the faculty member of that institution, and you will be helping the primary health center or a state government, where you can be used for the screening and also appropriate the health education. Definitely students can participate, but with the supervision of the faculty of the institution. Next question.
I think, sir, we can close the session now because we do not have any relevant questions on these sessions. But there are 765 questions. I think whichever is relevant, we'll answer them.
Okay, to all the participants, the only one message which I would like to give is we are facing a difficult, country is facing a challenge of this pandemic, and we as healthcare professionals, we are having a very important role to play. And the day we enter into the nursing, the caring is one of the core component of the nursing, which we have all learned. And the final year students already they must have learned. So this is a challenge for us to display our whatever we have learned during the period of training. And definitely at the highest level of the government of India and also the state governments, they are recognizing the role of the nursing professionals. You can see how the Prime Minister of India is taking a concern of talking to the nurse, and especially you must have seen in the video and also in the clips in the news that especially Prime Minister of India has spoke to one of the nurses in Pune. So that itself shows the concern. And also we are seeing the challenge of some of the staff nurses who have taken care. One of the latest messages coming from the Kerala, where she could take care of one of the patient, and she acquired the positive infection, and she was under quarantine and treatment, and now she has become the infection free. And the health minister of Kerala spoke to that nurse, and the nurse was so positive, and she has told the health minister that she's getting back to the treating the patients in the hospital. So that is the level of the commitment many of the nursing professionals are showing. And also this is a big challenge for the nursing professional, where the World Health Organization is celebrating the International Year of the Nurse and Midwife. I think we have a big challenge which we have to demonstrate our commitment in this pandemic. So therefore, the nursing professionals, we have an opportunity to show our commitment in taking care of in this the where the country is facing a big challenge. And therefore, I request all the nursing professionals, be positive, be committed. And I could see some of the people who are, I think, in spite of Bharti was making a message of that not to chart. I think we as the nursing professionals, many of the people have considered nursing professionals are the most single professionals are disciplined people. I think we have to, some decorum has to be maintained in the classes. Yes, you all might be knowing the knowledge. This is an opportunity we are giving by the Indian Nursing Council to refresh your knowledge. And if and again you have an opportunity while you are displaying in the hospital and in the committee, there are different the situations you are going to face, but you have to take a decision what will be the appropriate to prevent yourself, and also to prevent to take care of the safety of the patient and safety of the nurse is very important. We have to keep in mind while taking care of the patients. Anyhow, we will be coming back again day after tomorrow on Monday, and again we'll be leaving these videos for you to consult, and this will be a referral. I know that, don't take that we are not taking the basics of the program. We are only reiterating. So in that perspective, you have to take this webinar. Thank you very much. Wish you best of luck.
Thank you so much, sir, for encouraging all our nurses. I think we, the nurse, can show our power in the hospitals, like power of care. I'm not talking about the power of at the administrative powers. We can show the power of care to the patients, and we can reduce this COVID-19 outbreak by giving more care. The patients can move out as per the 14-day isolation from the hospitals and from the quarantine if we give a proper nursing care. So I think Dr. Punita, Dr. Savijit Kaur has given you a lot of information and how to prevent this infection control, how it can be acquired, how it can be prevented, how it can be treated. So I think please ensure these guidelines are followed. These guidelines will be posted on the website of INC from time to time as we receive from WHO or from Ministry of Health and Family Welfare. So thank you very much to the panelists and the president, sir. And thank you all. We see you again on Monday at 11 a.m. I think this was a very informative, and I feel more will participate on Monday. So thank you very much. Namaste.
Thank you. Thank you all. All the best.